Welcome back. In this video, I'll teach you everything that you need to know about emphysema. We know that alveoli makes the lungs. These alveoli are small air sacs that are grouped together. They have to have very thin walls to allow maximum air exchange. Emphysema is mainly caused by two conditions, either if the patient is a smoker or if the patient has alpha-1 antitrypsin deficiency. In a smoking patient, the toxic air will go inside and will damage the alveoli from the inside out. So we will see alveolar centroacinal destruction, which means that the damage is mainly in the center going outward. And it makes sense because this is the area that comes in contact with the smoke first. Because as we know, the upper side of the lungs have more air and less blood, and the lower side has more blood and less air. Now the other cause, the alpha-1 antitrypsin deficiency, will cause pan-acinar destruction. Pan meaning total or whole, so the whole acini will be destructed. Normally we have an enzyme called trypsin that would destroy the lungs very slowly, but we also have another counterpart, the antitrypsin. The antitrypsin counteracts the trypsin, and so our lungs stay healthy. Some patients have deficiency in the antitrypsin, and this is called alpha-1 antitrypsin deficiency. And that's why they have destruction of the lungs. Now because this is an internal issue, the entire alveoli will be affected, and not like smoking from the center out. And that's why we call it pan-acinar. The destruction of the alveoli has a classic appearance of enlarged air sacs. Mainly, the multiple alveoli close together will fuse, forming a larger air sac. This is of course not ideal for air exchange as the surface area is very low. If we take a chest X-ray with a patient with emphysema, we'll see increased anterior-posterior diameter with a barrel chest appearance. And because the lungs will have destructed alveoli, it will have a lot of air and minimum surface area, and so it will appear lucent, which translates in the X-ray as dark areas. Spirometry will show decreased DLCO and recoil with increased compliance. The expiration phase will also be longer, and they tend to expire or exhale with pursed or semi-closed lips. This prevents the enlarged alveoli from collapsing. And here's a small quiz. Which of the following cells mediate chronic inflammation? And the answer is CD8. Alright guys, that's all I have. Thank you so much for watching, and hopefully this helps.